The content herein is for informational purposes only, not intended as medical advice, diagnosis, or treatment, and is not to be substituted for direct advice from your doctor.
Today's LymphCast program is proudly sponsored by VitaSupport MD, the makers of Vein Formula 1000 and Lymphatic Formula 1000. These MPFF-based nutraceuticals are backed by science and recommended by doctors specializing in venous and lymphatic disorders. Visit VitaSupportMD.com to learn more.
Well, greetings and welcome to our LymphCast show, episode 65 tonight, believe it or not. Tonight's show is brought to you by VitaSupport MD. They make Vein Formula 1000, Lymphatic Formula 1000. You can find them at VitaSupportMD.com. Check out our website, LymphCastNetwork.com. Everything is there. We're on every podcast platform out there. We're on YouTube, and you can find all of that through our website, LymphCastNetwork.com. If you have a question for the panel, send an email to hello@LymphCastNetwork.com. One more thing before we start. If you would like to support the show, we would welcome you to do that. You can buy us a coffee, but not a real coffee, right, Dr. Chuback? That's just a phrase we use. Is that correct?
Euphemism, apparently.
Okay. Although if they buy a real coffee, we'll be glad to drink that as well. But this way, you can support the show. And you go to buymeacoffee.com/LymphCast Network, and you can donate to the show to help meet our expenses. We'd appreciate that. Again, buymeacoffee.com at LymphCastNetwork.com. Our guest, Amy Rivera, is here. Our producer, Dr. Diane Chuback, is here. And the gentleman who started the show, physician surgeon from New Jersey, Dr. John Chuback, is here. And with that, I'll turn it over to our producer, and I guess part of our hosting team tonight, Dr. Diane Chuback, and she will introduce our guest to you, and we will get the show going. Take it away, Diane.
Well, thank you, Paul. So tonight's show is going to be about literally everything you need to know if you have just found out that you have lymphedema, because the person that we're welcoming today is just a wealth of knowledge. She's a walking resource. Everything she has done, I think arguably, she is probably one of the most important people in the lymphedema community today, because her voice, she was one of the first voices out there advocating really for the mindset, for the strength and mindset that one needs to overcome this, to be able to manage it, deal with it, and to live one's best life with it. So we're as Paul mentioned, we're welcoming once again Amy Rivera, because I think she's our most frequent guest as well. Amy, I lost count on how many times you've been on the show, but that speaks to how active you are, because there's always something new. There's always something going on with you. So I'm excited to talk about everything today. But Amy, you are an author, you are an advocate, you are an international speaker. 2 books that I know about, which are the Lymphedema United, which we talked about. We had several shows about this book with Matt Hazeldine, and Drop the Skirt, which was obviously your way of saying, I'm not hiding anymore. Now I literally am going to learn to live with this and advocate for the people, for myself and for the people who have lymphedema. But you're here today to tell us about your exciting new venture, and that is the Rivera Method and your new website, which is just incredible resources. But I will let you tell us all about that. So welcome, Amy. Give us a little lowdown on how you're doing.
Thank you. I'm a little teary-eyed with that intro. I really appreciate that. It really is a nice reminder to see how far I've come just in my own personal journey when I see how many other people I've been able to help. So again, thank you. And I love coming here. I feel like I'm just hanging out with some friends, and we're, talking about all great things, inspiring and motivating, and obviously how to thrive in any situation, not just someone who lives with lymphedema. We're all human beings, and we all can use a little encouragement from here on out. And so that's kind of what I've been focusing on lately. So for those who are new to this podcast, my name is Amy Rivera, and I was born with primary lymphedema. It affects the entire right side of my body. It did affect the entire right side of my body at birth. However, I have come to find out it affects my entire body, and I was one of the first in the United States to reduce my right leg from being 200% larger than my left leg to 2 to 3% larger. And it's been a 15-year journey. And so I learned a lot along the way. And because this journey was so lonely and isolating, I wanted to create something that I didn't have, that my family didn't have, or my caregivers at the time when I was officially diagnosed with primary lymphedema, which didn't happen until I was 32 years old, and I was born with it. So it was a long time not to know what to do, or to know what was going on with me, or to even feel somewhat connected to somebody who was dealing with something similar. So that's what brings me here today to talk about the fun things that I do, the Rivera Method and the Lymphedema Blueprint course. Sometimes I think that I just get bored and I'm like, what can I do next? But honestly, what happens is I use my journey in real time to help educate others, because I'm still learning about my own lymphedema. I'm still learning about how I can properly handle it, when it changes. Lymphedema symptoms change often and frequently. And so in order for me to maintain my own health, I really put myself out there to help others, because it keeps me accountable. Because just like everybody else, I too get tired of it. I too get depressed. I too want to cry. Sometimes I don't want to wear my compression, but I'm quickly reminded that if I'm to lead a community of people that are dealing with the same things I'm dealing with, I must lead from the front, and I must lead by example. So that's why I do all these projects. It's really to help me maintain my own quality of life, while I help others learn how to do the same.
Yes. And so much of your leadership is, and this is the true definition of leadership. And it's not really to be the person in charge. It's just to empower others, to be their leaders also, and to take care of their own. And I think the most important thing, as I was saying before, is that, you took something, a disease that was really, truly, I don't want to say unknown, but a lot of scarce information, a lot of scarce things being taught in medical school. The doctors didn't really know. The diagnoses were, not exactly spot on. And this is just unfortunately the plight of people with lymphatic disorders. It's just the lack of knowledge in the medical community. It's getting better, thanks to people like you. But the most important thing that I think you put out there was the fact that, listen, we need to rely on ourselves. And sometimes we need to teach our doctor. We need to, guide them into how to help us. So that's how you started your foundation, your ninjas fighting lymphedema, because to have that, and then that's exactly describes the type of mindset you have to have. You have to have an activist mindset, and just like a fighter, and, bounce back no matter what kind of adversity, and just be resilient. Tell us a little bit about that foundation.
Sure. So it's a lot of people, when I first started the foundation, so many people are like, why ninjas fighting lymphedema? They're like, what's going on here? And this name is very, very important to me, actually, because I was often overlooked. I was misdiagnosed. I wasn't heard, and I was just dismissed. And ninjas hide in plain sight. And here we are walking around, 10 million of us in the United States, walking around with something that we're being misdiagnosed, we're not being heard, we're just being gaslighted, all of these things. For whatever the reason is for that experience, I felt like we're ninjas, because every time we're not heard, we have to get up and fight. Every time we're misdiagnosed, we have to get up and fight. Every time we see a new doctor or a therapist or something, we have to re-explain. And so we are ninjas fighting lymphedema. And I have that fighting mindset, that mentality. I don't give up very easily. And so I wanted that to be the forefront in the face of what we were actually fighting in the world. And that is to spread awareness, also build a community, something I didn't have. Ninjas Fighting Lymphedema actually started at a radio show. I was being interviewed on a radio show, and I said, I really want to do this organization. I really want to fight. I really want to do this. And we're like the ninjas. And that's where it really came from. And from that radio show is where the vision and everything blossomed. And it just happened so naturally that it is who I am. It was my first way of advocating necessarily in the community. And it started as a Facebook group. I wanted to see how many people out there were suffering in silence. And I was blown away with the amount of responses, people from different countries, not just in the US. And I saw the need for a voice. I saw a need for the education. I saw a need to build that community. And that's where Ninjas Fighting Lymphedema came from. It was created from something I didn't have once again.
Yeah. And I just feel that, your journey through this might have started in chaos, because you're just kind of reaching out there and trying to do this and fight and become an advocate and start build your voice on this. But I have seen your progression into something that now is more contained, sophisticated, put together in a beautiful body of work and knowledge, and something that all people can access. And so this is where we are now, right? We have your website, the Rivera Method. We have a beautiful course, right? It's called the Blueprint. Tell us about that.
So yeah, the Lymphoedema Blueprint course actually came from years of frustration. I have thick files of appeals, of research, of incorrect information, misinformation, good information, but it didn't come from one resource. It actually came from one door closing on me after another. And as we all know, we who have lymphedema, time is not on our side. So every time that door closed, my disease got worse. So when I would take 2 steps forward, I would take 5 back. And so I kept all of this documentation because I knew one day I wanted to help people, as many people as I could. And I wanted to put something together that I could just hand to someone and say, here is your first responder kit. Because I remember when I was in the doctor's office in Chicago, and it was the first time I ever heard primary lymphedema. And when I heard those words, everything else stopped. And she continued to speak. And I didn't hear anything she said because I was stuck on those 2 words. The first reason was there was finally a name to something I was dealing with. 32 years of my life, I didn't know what this was. So I was really excited that there was a name, because to me, if there's a name, that means there's other people like me. So that was the first thing. The second thing that stopped me dead in my tracks was there's no cure. And it progressively gets worse. So there I was, like I just won the lottery. I have a diagnosis. Like this was huge. This was to celebrate. And then all of a sudden, we're just going to yank those winnings away because it progressively gets worse and there's nothing we can do for you. How devastating is that? Especially to a young mother who had all this energy internally that wanted to share it with her children and wanted to build experiences with friends and family and peers. And I'm being told there's nothing I can do and it's going to get progressively worse. And I'm like, well, how in the heck can it get progressively worse than this? I was literally at the elephantitis stage. My leg was 35 pounds heavier than my other leg, chronic pain. My quality of life was in the dumps. I was like stuck on that. So I know where someone's at when they're diagnosed. I know every emotion they're going through. I know all of their fears. I know their anger. I know their tears, and I know their pain. And if I can ease that moment for them just a bit and give them everything they need, including myself if they need me to help guide them, to ensure that they don't ever feel the way I felt in 2013 in Chicago, sitting on that bed. And that's where the Lymphedema Blueprint course came from.
That's incredible. So tell us how, I know that there's three main parts to it. But first, the first thing it seems like you're advocating is for telling this individual to learn everything they can about their diagnosis, learn everything they can about the physiology, the anatomy, everything that is changing in their body because of this illness. And then, and I guess I imagine that's a way to come to terms with it or just define it. Clarity helps. Just like you said, not many people would jump up and down because they got a diagnosis, but because it gave you clarity. Okay, now I know where to go from here. Mm-hmm. I could stand on something. And then, so tell us sort of the phases of learning in the method.
Absolutely. So in order to really understand how to treat lymphedema, we have 2 steps prior to that. And part of my personal experience with treating lymphedema is we've only focused on treating the symptom through different treatments, therapies, and things like that. So I want to be able to help treat the entire individual. And how we do that is we first must connect with our mind. We must have a strong mindset because this journey is tough. And it's not a race, it's not a sprint, it is a lifelong journey. And so we must be able to continue to pour in ourselves in order to mentally pour in ourselves so we can physically begin to pour into ourselves. So the first thing we must do is have that mindset, that those pillars, that foundation, to understand that this is going to be the journey. Once we have that mindset under control and prepared, because it's a tough one, then we're going to go into understanding how the body works as a whole. We must understand the anatomy. We must understand, what does the lymphatic system actually do? I know I have the swelling, but what does that really mean? And so we really want to focus on how the body works. So now that we're connected from our mind, and then we're connected with how the body works, now we're going to connect with our heart, and we're going to really focus on how to treat the lymphedema, and then we learn about lymphedema. So learning how to treat the lymphedema symptoms is the very last stage. It's not the first. And these courses, these modules aren't taught just by me. I don't teach them. I want to just say that. I give my personal experiences, and I do the introductions, and I do the closings. But we have experts from the community who actually teach these modules. We have a nutritionist. We have physicians. We have different types of therapists. We even have interacting modules for like breath work and body movements and all these different things. We have 67 pages of literature, all the way from mindset to dry brushing to nutrition to supplements. Everything you need is in this course. And then we, of course, offer continuing education as new things come up. If this is my passion, is to share that information with my community so they know what is the newest treatment or product or technique that's out there. Because as I said earlier, lymphedema is always changing. Especially, I just had a huge change in my own lymphedema symptoms. And I understand when you just think you have it under control and you're like, now what? What do I do now? And so that's where the continuing education comes from.
Vein Formula 1000 and Lymphatic Formula 1000 from Vita Support MD are backed by science and sold in doctors' offices. If you're a physician who may be interested in prescribing or selling these excellent nutraceuticals, please call 862-246-7877 to speak to a representative today.
So the education is there, but I think the other resources you have, I know, is the the Fast and Go, is that your product? So this is like a compression bandage. I mean, it seems like this is one of many other products that you offer or that you give access to.
Yeah. So in the course, we do talk about Fast and Go, but we also are getting ready to launch a therapist assisted multi-layer bandaging module, because it's really important to understand the foundation of treatment. So before we get into these innovative products like Fast and Go and these wraps and ingestible wraps and things, we must understand the cornerstone of treatment: manual lymphatic drainage, the multi-layer bandaging, the foam, what it really means to decongest, because that plays a very important role in our treatments. But as we continue to decongest on that journey, or we get to the point where we understand that our symptoms change, there's where products come in like Fast and Go, which Fast and Go is the one and only hybrid compression. We call it a bandage, but it does act as a wrap. That's a single layer, multi-component compression bandage. And what that is we have the components of a short stretch and a long stretch combined in one bandage. And so it's really made for the users at home when maybe they're in between therapy sessions and they soil their layer bandages, or they come out of therapy, and I can contest to this. This has happened many times. I go walk into my car and my bandage is already sliding down, and then I have to drive home with these big old bandages, which could be a risk itself, or you're walking and all of a sudden the bandages start, coming undone. I think every situation with bandages I've experienced. So where Fast and Go comes into play is to kind of maintain the momentum we've already started, especially in our therapy clinics when we're going to get MLD, but we don't see the therapist again for 2 days, but we have to keep that compression on. This is easier for the users. Or maybe if they are claustrophobic and they just can't really get with the multi-layer bandaging and so forth. So Fast and Go is just another option for the toolbox. And I do have arm kits and leg kits and below the knees. And I also offer like Expandostocks. And so if you see the theme here, it's really about bringing innovative solutions to the drawing board and saying, try something. It may work, not work, but we'll figure out a solution for you. And so that's kind of where the whole Rivera Method, the course, and just the vision I'm working towards is really bringing in the innovative, individualized care treatment ideas through my products and through just the Rivera Method.
And I think that, in the time I've spent working on this podcast and being on it and producing it and stuff, and the one general theme that is there is that there's so much variation. So much variation in the etiology of the disease, and so much variation in what works for some people won't work for others. But the most important part is that you have to begin the journey. And that's the only way to know and to modify it. As Dr. Chuback would always say, it's a multifactorial thing, and it's a multimodality thing in terms of managing it. And I know, Dr. Chuback, you have a lot of experience with wraps and things like that, and people not being compliant. And how does Amy's product sound to you?
Well, I think it's fabulous, and I think that, as you said, the key to good medicine, healthcare, is, I always say, that word is not an accident. It gets treated like an accident now, but health comes from caring about yourself and finding others who will care about you. And unfortunately, medicine is changing in a way where it seems like nobody cares. It seems like the only thing people care about is business, money, volume, numbers, statistics. And as corporate entities and private equity and venture capital and all these things get involved in the care of human beings with medical problems. And so I think when we go back to my father's generation of being a physician and a healthcare provider, and my training many years ago, I'm old enough now to say many years ago, things have changed quite dramatically because it was this, I think bandaging is a perfect sort of metaphor for what we're talking about. It has to be a perfect fit for the patient. And finding a perfect fit is very difficult, right? Having a bandage, and what Amy's talking about, I mean, I've been through all of this as a general surgeon and working in wound care clinics and wound care centers and taking care of all kinds of sick patients from the time I was doing my early general surgery through all of my cardiovascular and thoracic training. Just something as quote unquote simple, and it's not simple, but something that sounds as simple as a bandage. If a bandage is applied inappropriately, if it's a bad fit, not only can it be useless, it can be dangerous. So the bandage, and in many ways, and Amy just actually touched on that, the bandage that slides down is obviously not bandaging the area that it needs to be bandaged, and therefore it's at best it's ineffective. But a bandage, let's say, that slides down and let's say a thigh-high bandage, it slides down and collects behind the knee, the bend in the knee, can cause something aggravating, painful, and annoying, like an abrasion, a laceration, and a wound behind the knee, and which can lead to scarring, long-term scarring. But it can also, if left uncorrected, it could lead to something more serious like a DVT. It could lead to something more serious like arterial obstruction to the lower extremity with a tourniquet effect. And all of these things have been described. These aren't just theoretical concepts that I'm coming up with in my head. And of course, other things like maceration of the skin, where the skin becomes so compressed that it's dying off because of a lack of blood supply, and the skin gets sloughed and so on, which can lead to infection and cellulitis. And so these are not minor issues, and that's why something like bandaging has to be taken very seriously, has to be done by professionals who are properly trained, who understands the patient, who cares about the patient. And therefore, we need a lot of tools in the toolbox. The fast and go is definitely one of those tools that's really valuable. But as Amy said herself, there are lots of tools. You can't be a great, let's say, contractor and have just the world's best hammer. I mean, you can't get a lot done with one great hammer. You need a whole set of tools, and to know when is this tool appropriate in this situation. And even for the same patient, depending on what he or she is experiencing or going through, or the symptoms and signs that they're demonstrating at that time. We're just using it as an example. The fast and go might be okay for these 2 weeks, but then the following 2 weeks, we might not need a bandage at all, or we have to get out of that bandage or switch to a different multi-layer or a single layer, et cetera, et cetera. So it comes down to care, and it comes down to treating each patient with great respect, listening to that patient, examining that patient, as I've said many, many times on this show, speaking with the patient, communicating back and forth, having a dialogue. And that's how good care is applied. And I think that what Amy is talking about here, it's so ironic because at around the same time Amy was working on her blueprint course, I was working on my blueprint book, which I have a copy sitting on the shelf behind me, the blueprint for your personal success story. The reason why it's interesting and ironic is because a blueprint is a set of, it's a map, it's a set of guidelines to get you going, but it can't be applied in a hard and fast way so that there's no room for deviation and no room for modification and so on and so forth. But it's great to have a blueprint because it gives you a plan on how to get started. What are we building here, right? One of my old mentors used to say, if you come across a guy laying bricks in the city, and you say, wow, you're doing a fantastic job. What are you building there? Guy says, I have no idea. That's a problem. Just to say the guys in the white coats, they'll come and take you away, bring you to a safe place. You have to know what you're building, what you're working on, what your objective is, right? Mm-hmm. So that's why I loved Amy's idea of the blueprint, but it's not a set of laws. It's a way of seeing the big picture. What am I trying to achieve here? I have a leg that's 35 pounds greater in weight than my other lower extremity, than my other lower limb. Okay? What I'm trying to achieve is to get this leg smaller, healthier, with a better overall circulation, arterial, venous, and lymphatic, so that my skin is as healthy as possible, that I don't wind up with dermatitis, cellulitis, ulceration, etc. And so at least we have an idea. Where are we going? What does the path look like? But that path is going to be somewhat winding and circuitous. And that's why we still have human beings in medicine. And there's no one size fits all, one bandage fits all, one stocking fits all, one operation fits all approach to great healthcare. And that's why for the foreseeable future, I think there are going to be sentient, caring, empathic human beings involved in the delivery of great medical care.
Yeah. And I think, that kind of brings me to the next point with, I think the blueprint educational method it sounds absolutely incredible, and someone will truly have to find their own way through it. But you do offer direct consulting. So someone can actually work directly with you. Tell us a little bit about your consulting services.
Sure. So first off, I totally agree with Dr. Chuback said. It's exactly why I created it. And even with Fast and Go, when I do have one-on-ones with therapists and they're like, is Fast and Go right for my patient? I will still help them find the right product, even if it's not, because I'm not here to sell a product. I'm here to give a solution. And so I'm always willing to look at all the tools in the toolbox, even, again, my own health. Sometimes I can't even wear my own product. So I completely understand that. But as far as the consulting goes, I do offer consulting, especially for those who are maybe struggling with insurance appeals. Quite a few of those. And I do have extensive experience with that, 2.5 years experience along with my own journey. And I've helped quite a few people with their own appeals and their surgical process. Part of that, what I've learned is that I learned what my rights were as a patient, and I learned what my rights were when it comes to insurance policies and what does it actually say. And so I've been doing that for about 10 years, and I'm just now getting to the point where I'm getting really just used to it because I feel like I'm seeing the same denials over and over again, and it's kind of a repeat process. The same situations, if it's experimental or it's this or that. And so I've learned to really learn how to consult people on what to say and how to say it and what your rights are. I also consult with people who maybe are looking for physicians or different therapies or therapists, or I have a few who just sometimes just need me to listen. It's as simple as that. Sometimes they just need to get it all out. And so what I've done is I created an individualized consulting program. So it really depends on that person and what is the fit and where is the need. I keep saying this. The individualized treatment is really what we should focus on. And so my consulting is just as unique as any other tool in the toolbox. It really depends on that individual and what they need at the time of my service. And then the other side of that is I do consulting for like companies And I also work on different projects like glide projects and so forth. So not only am I focused on the here and now with our community, I'm also focused on the future. And I'm leaning more into that as I consult people. I also learn to see what is in the future, what is offered, and how can that better help me to help those that I'm helping, currently or assisting in my consulting.
That's really cool. You mentioned surgical options, and for some people that is the right way to go at their stage of the game. And we've had a few surgeons on, we've had other therapists who'd spoken about surgical interventions, and so you're at the forefront of honestly knowing what's out there and what works. What is your feeling on surgery and how well it works for people?
Sure. I'm actually glad you asked that, because a lot of people think I am pro-surgery, just pro-surgery because I had surgery. I'm actually not. I am pro whatever you need, whatever that treatment is. I will tell you, there is a therapist in Mexico that I follow. He's called the Lymphologist on Instagram, but he sees the most severe cases that I have ever seen. And I was one of those cases. And if I would have known him before I had surgery, I would have went and spent my time with him to see what he could have done. So for me, surgeries really are dependent on the type of lymphedema, the stage, the individual. This is really an individualized choice. I don't have an opinion of surgery or not. My opinion is of what is best for that individual. And sometimes surgery is not.
Yeah, I think we've had a number of surgeons now from a number of different backgrounds with a number of different techniques. We've had some surgeons, microvascular and super microvascular plastic surgeons who are doing lymphovenous anastomosis and some lymph node transfer. And then we've also had surgeons actually, one very recently, but one in the little bit distant past now, a year or two ago, who has tremendous experience in liposuction for lymphedema. We've had some liposuction for lipedema, but we've had liposuction for lymphedema, which I found quite dramatic, but also incredibly impressive. It has to be done, obviously, extremely cautiously and with the proper patient selection in the hands of a true expert. But Amy, do you mind sharing, and if you do, please, of course, let us know what surgical procedure or procedures you have personally undergone and what your experience with them have been?
At VitaSupport MD, we believe in creating the best bioflavonoid-based supplements to support your vitality. Bioflavonoids are found in abundance in nature and support excellent health and wellness. The demands and stresses being put on our bodies in these challenging times are unlike any we have seen before. Support your body with the flavonoids it needs to fight inflammation and oxidation. Unlike other products in the marketplace, VitaSupport MD dietary supplements use micronized flavonoids for optimal absorption and effectiveness. Micronization is an advanced process which creates an ultra-fine powder easily absorbed by the body. At VitaSupport MD, we are passionate about making your good health our life's work.
So I had 3 total surgeries. The first one was in 2013, directly after my diagnosis. And that was in Chicago, and I had a lymph node transfer. They took the nodes from the right side of my neck and then planted them in the pelvis area, a little bit in the pelvis area, more of the upper thigh, groin area, I should say. And that transfer took 8.5 hours. Now, what we didn't know then was that probably with my case, I probably should have had the liposuction first, because what happened was once the transfer was in place, I started to feel a little bit better. Like internally, I felt a little bit physically healthier a little bit. And I started to see the skin on my leg flake off, the dark skin. And I started to see new skin growth, new hair growth. So I started to see some improvement. I only saw about maybe 15, 20% reduction in circumference. But then what happened was the transfer got overloaded with the amount of fluid was being pushed through. And some of them were trying to do MLD and break down some of that fibrotic tissue, and it just didn't work. So the transfer ultimately died. And then in 2015, I saw a surgeon here, and this here in St. Louis, and he claimed that he knew the type of liposuction that needed to be done. And he claimed he did the SAPL, which is a suction-assisted protein lipectomy. When I woke up from that procedure, not only did I find out it was just general cosmetic liposuction that was done on my right leg, but I also woke up in cosmetic compression. So I had 2 failed procedures before I saw Dr. Granzo in 2018, and I wasn't quite sure if I could mentally handle a 3rd failed procedure, so I almost didn't go through with it. But the amount of pain I was in, I was willing to do anything at that point. So in 2018, I went to see Dr. Granzo, and he did the SAPL procedure. He removed 4 2 liters of solid, which for people that are listening, it's 4 like 2 liters of soda. Like he had 4 2 liters of soda he removed out of my leg, and he did a 17-inch skin resection. And the reason he did the skin resection was because he didn't know the integrity of my skin before the procedure, but we knew that that might be a possibility. And unfortunately, when he went in my calf area with the cannula, my skin integrity was so damaged that the cannula went out the other side of my leg. So how he explained it was he didn't know what layer was fascia, muscle, and so forth. It was all intertwined, and it just looked like toxic sludge and real hard fibrotic dead skin. So we removed that. That surgery has been successful. However, I still wear two layers of garments, a custom class 2 and a custom class 3. And now I have lymphedema, and it's not from the surgery, but I have it in my pelvis area and my left leg. So my primary lymphedema has moved as we suspected, but my procedure has been a successful procedure. So 1 out of 3 actually worked for me.
And you never, the one thing you haven't had is the lymphovenous anastomosis operation.
Correct. So after 2018, I was supposed to have maybe 1 more SAPL with Dr. Granzo because he was aggressive, but he wanted to leave room for healing to see how my skin would heal. And that would possibly need another SAPL. And then after that, I would go in to have that procedure. However, because of my health journey and my lymphedema and it spreading, I am not comfortable moving forward with any procedure at the moment until I really understand what's going on with my own health.
Wonderful. And I think that's another key takeaway here for our listeners, that as Amy has pointed out, you have to really advocate for your own health. And ultimately also always keep in mind and never forget that you are the ultimate gatekeeper and decision maker for your own body and your own health, and that physicians, clinicians, therapists, etc., are there to provide guidance, opinions, suggestions, plans, alternatives, etc. But ultimately, the decision has to be your own, and it has to be a decision that you come to very thoughtfully and that you feel very comfortable with. If you don't feel comfortable, my suggestion as a surgeon on this program, having done all kinds of surgeries, from the most minor to literally the most major, it always has to be a concert between a patient and a surgeon. It can never be a contest. And so don't let anybody, and when I say sell you on, I don't mean from a financial point of view, although that can be a concern also, sadly, but I mean it from a philosophical point of view. Don't let anybody sell you on a surgery or a procedure that you don't feel 100% confident about. Now, when I say feel 100% confident about, that doesn't mean you should ever expect to have 100% a perfect outcome, or that there are operations of any kind, no matter how small, that don't come with some potential complications, hazards, stumbling blocks that need to be dealt with, because there's no such operation. Even removal of a small skin lesion or a drainage of a cyst comes with potential complications. I mean, feeling comfortable accepting those complications, risks, potential pitfalls, and weighing those against the upsides and the benefits. It's what my old professor, Dr. Goldfarb, used to describe as the juice to squeeze ratio. What is the potential benefit to come from this procedure, and what are the potential hazards? And anybody who tries to convince you that there's a procedure of any kind for any disease and any condition that doesn't come with potential hazards is not being honest with you. So you have to advocate for yourself, you have to educate yourself, and you have to decide for yourself. And then in the end, you live with the final result, God willing, and hopefully in the vast majority of cases, those results are going to be positive. But if there are negative aspects or components or consequences, then one has to accept that you want to be in a position that you don't feel that anybody pushed you into it or convinced you of something you didn't believe in, because it's hard enough to be in that situation to begin with. And you don't want to beat yourself up and say, I knew I shouldn't have done this. If you go into an operating room as a patient saying, I know I shouldn't do this, or certainly as a surgeon saying, I know I shouldn't do this, and everybody should take the day off from the operating room. That's not a way to go into surgery. So the other thing I would say on that is I do like this idea that, and Paul knows this from some of the philosophical personal development work we've done together and those podcasts that we've done. I like this idea of no one is coming to the rescue. And what that doesn't mean nobody's coming to help you. Everyone is coming to help you as a patient under ideal circumstances. Surgeons want to help you, therapists want to help you, dietitians want to help you, nutritionists want to help you. If there are psychotherapists, psychologists, etc., involved in your care, they want to help you. But as Amy has always been a champion of this, as the ninja that she is, you are really the leader of your healthcare team. You are in charge of your healthcare. And those folks are there to do their very best to assist you in living out this blueprint and traveling that healthcare journey, as you so aptly call it and so correctly call it. But you're the one who, as you said earlier in the program, not only has to lead from the front when you're advising and consulting with others, but particularly lead from the front when it comes to your own healthcare journey, your own wellness, and your own quest for living the best life that you can live.
Yeah, yep, that's exactly it. And I'm also leading the way when I just had a consultation yesterday about this very question. Should I have surgery with this surgeon or should I go with this surgeon? I'm really not feeling this way with the surgeon. And I've already had poor results. And that person was being pushed into, I can help you, I can help you, I can help you. But they were feeling, I don't think I should do this. And so after speaking with them, I gave the exact same advice. You really have to think about, is this what you need? Not what the surgeon wants, but is this what you need at the time? And if it is, then the second question is, are you comfortable with what's going to happen post-surgery? And I do ask that question because depending on which type of surgery there is, there's different types of healing. And a lot of people, the big misconceptions that we have about surgery is, one, is that they think they should see results immediately, and they don't understand that their body has to heal, and then things have to wake up and regenerate. And the body is so amazing, but it's not that amazing where you see results, 2 or 3 days later, because you have all these other things involved with the healing process. So that's the other part that I have these conversations with people about is, are you prepared for the recovery part? Are you prepared for a possible infection? Are you prepared for the pain? Are you prepared for the being dependent on someone? Just depending on what the surgery is. And sometimes that also, helps them make that decision for that time in their life. And so I don't ever say surgery is a good thing or a bad thing. It just really depends on the individual and what they need at the current time of their journey.
And I think that's great. And, we talk about, starting out as the ninja, right? And the fighter attitude. And now I think the best word for you, Amy, truly is pioneer, because, you were one of the first real voices out there giving this information or just sharing your own experiences and people finding you and finding each other for this kind of support. And everything that now that has come together on your website and what you're offering people, tell us the name of the website and how they can get in touch with you.
Sure. It's riveramethod.com, and you can find all of my socials on the site. You can reach me, our email is on there, our phone number. So anything you want or need from me, you can go to riveramethod.com and find it there.
That's absolutely awesome. Well, Dr. Chuback, if you have nothing else, I would love to just thank Amy so much for being on the show once again, sharing all of her insights with us, her actionable insights, as she says. And it's been a great show.
It's always a great show when Amy's with us. I know for certain it won't be our last time together. And I think that each time that we come together and we have the time to sit and talk like this, I'm even more inspired by her. And I think that she has made a major impact in this world of lymphedema, and especially, I think, for women, because it is a very, very difficult. Of course, we've had men on the show, and through Amy's book, and I'm in no way dismissing the importance of lymphedema for men, because it's an incredibly important subject. But I think Amy brings something special to this experience as a woman, as a wife, as a mother, and how important that is in affecting every aspect of her life. And that's why I think her consulting work and coaching work that she does with other people, and I'm sure she has male clients as well, but especially for those women to have a sounding board, as you said, sometimes to just get it all out and get it off your chest and speak to somebody who could understand. every aspect of what it means to be not just a human being, but a woman living with lymphedema. And I think that, I've done it many, many times in the past, but I'll congratulate you and thank you once again for that work that you're doing.
Thank you. It means a lot. And, this is more than just a podcast or a program. Like, we're friends, and I can't wait to actually come there and meet you guys. But, the one thing I will leave with this is the sense of community. It doesn't matter if it's you, Dr. Chuback, if it's Diane, if it's someone who has lymphedema, if it's a therapist. When you meet someone who really is a champion for you, you're instantly connected. And so I am blessed to have you guys as a connection in my life. It really helps me to continue to move the needle forward. And it also helps me just remember why I'm called to do this. So I appreciate your guys' time. And I would love that coffee. I know to buy a coffee, right? I love coffee. So one day maybe I'll buy you guys an actual coffee. And what is it around? And enjoy each other's company. But until then, I thank you for the time that you guys have spent with me this time and all the previous times.
That's been our absolute pleasure.
Pleasure.
Sure.
Thank you.
All right.
So you want to take us out?
We are. Always a powerful show when Amy Rivera is on, isn't it? Always a powerful show. Amy, before I wrap it up and go around the room, put out your website again, if you don't mind.
Sure. It's riveramethod.com.
Easy to remember, riveramethod.com. Excellent. And you've been listening to the LymphCast show, episode 65 tonight. Visit our website, lymphcastnetwork.com. If you have a question for the panel, email us, hello@lymphcastnetwork.com. The show has been brought to you by Vita Support MD. They make Vein Formula 1000, Lymphatic Formula 1000. That's the company. The founder and the owner is Dr. John A. Chuback. You can find them at vitasupportmd.com. And as Amy mentioned that she's going to do, we ask you to buy us a coffee as well. If you are able to do that, help support the show. Just go to buymeacoffee.com/LymphCast Network, and we appreciate that very much. With that, Dr. Diane Chuback, before I thank you, and Dr. John Chuback, could you go ahead and officially and formally and otherwise thank our special guest tonight?
Well, again, I will thank Amy for being here, and it's always a pleasure. And, the door is always open. The invitation always stands when it comes to you. So thank you for all you do.
Thank you.
All right, and thank you. The producer of the show, the woman behind the scenes, but she's in front of the camera tonight and in front of the microphone, Dr. Diane Chuback. Thank you, Dr. Diane Chuback, for everything.
Thank you, Paul. It's been a great show.
Absolutely. And again, the founder, owner of Vita Support MD. He's also the founder of this show. This is his whole idea. From New Jersey, as you can tell from behind him, author, but also physician surgeon, Dr. John A. Chuback. John, thank you much for everything, sir.
Thanks, Paul. I'll just end by saying I always point out in these programs that it takes a team of people to care for people with lymphedema and lipedema and many chronic incurable diseases, manageable, certainly, treatable, certainly. And we typically go through that list, possibly a surgeon, a medical doctor, a lymphedema therapist, nutritionist, psychotherapist, psychologist, etc. But today I was reminded another key component, when possible, would be a really good coach/consultant, somebody like Amy Rivera with the services that she's providing, almost sort of a general contractor of the team, overlooking all of those other consultants, and working a bit as a quarterback, or again, a coach to manage all of that, because it's very complicated. It's very complicated physically, emotionally, psychologically, mentally, intellectually. These are complex problems, and I think that as she said earlier, have been dismissed for far too long, and that's the purpose of our show. And we just have one more person to add to the team potentially when needed and when necessary, and that would be a lymphatic health coach, advisor, consultant.
All right. Very well said, sir. And again, you've been listening to and or watching and listening at the same time to our LymphCast show, episode 65. We'll see you next time for episode 66 for the LymphCast show. Have a great evening.